Good afternoon. My name is Adrienne, and I'm utilizing Florence Nightingale's environment theory for the purpose of this video. The article that I'm going to correlate is the chronotherapeutic intervention for post-surgical pain. This is very fitting because I work in the post-anesthesia care unit, and we're often administering high-dose medications in post-surgical pain patients. The purpose of this article was to introduce a middle range theory that supports time-dependent or chronotherapeutic approaches to pain assessment and intervention that may be implemented by nurses in a clinical setting. As it regards to environmental clues and cues synchronize the number of attempts at self-administration for analgesia. For example, oftentimes with a PCA or patient-controlled analgesia, we can see the number of attempts that a patient has done to help their pain control. So we can notate that number of times, and if it's a high amount, we note that, hey, maybe this pain medication is not working. So we need to communicate effectively with the clinician to maybe get another type of pain medication. Unfulfilled requests of the anesthesia are reliable, or for the analgesic, are reliable indicators of the individual's pain status. In ICU, also regarding to environment, ICU and surgical wards often have a lot of light and noise. So the first thing we do in the PACU is decrease the noise. Decrease the lighting. For example, when I'm getting a patient in, I turn off all my lights in the bay to make sure that they, have less stimuli as possible. Physical pain has been linked to increased stimuli like light and noise. A lot of times, also the article indicates that a lot of times light can help in painful situations, like with patients with chronic pain, like opening the blinds and can help a patient's pain. Sometimes seeing outside and getting that light inside can help patients even stop the high-dose pain medications. So light and sound have a big influence on pain. Also, as it relates to health, physical pain can be related to mental health and vice versa. A lot of patients have anxiety and depression, which can contribute to how they perceive pain. So it's important for nurses to get a good history on the patients preoperatively in order to notate that, hey, this patient has anxiety and depression, and how it correlates to their pain. Also, as it relates to nursing, nurses sometimes lack knowledge and lack the communication skills that they need to effectively communicate pain management in patients. Those barriers can definitely affect how a nurse administers pain medicine. So nurses need to have a good attitude towards or have good communication skills to be able to effectively control their pain in their in post-surgical pain management. So, again, attitude leads to behavior, behavior leads to action on those types of nursing biases can lead to how a nurse administers pain medication. As it relates to the person, we often ask the patient, what's your pain level on a scale of 1 to 10? We use that 1 to 10 pain scale. Oftentimes in the post-anesthesia care unit, the patient is not able to effectively state whether a pain is on a scale of 1 to 10, whether they're delirious from the anesthesia or, they're just not comprehending that pain scale. We need to utilize other physical cues like grimacing and moaning and grasping at the pain site, those types of cues to help indicate whether a patient needs pain medicines or not. So looking at the overall person and the way they are physically responding can help in pain control and pain management. So the way that I'm going to utilize the environment theory in my practice is to continue to decrease those stimuli, decrease the noise in my bay as much as I can, to decrease the light and sound, to help with patient emerging from anesthesia and to hopefully decrease their pain. Also, I'm going to utilize the different physical cues in order to help me effectively assess their pain control, and communicate with the clinicians, with the anesthesiologists, and whether or not these pain medicines are effectively controlling my patient's pain. By communicating effectively with my coworkers and the anesthesia, I think we can all benefit from that, and the patient can definitely benefit from good pain control. Thanks for listening.